Welcome. Today, we're diving deep into a rare and often misunderstood condition that affects the blood vessels, Buerger's disease, also known as Thromboangiitis obliterans. This inflammatory disease primarily targets the small and medium-sized arteries and veins, leading to serious complications, especially in the extremities. Join us as we unravel the complexities of Buerger's, exploring its causes, symptoms, diagnosis, empowering you with a comprehensive understanding of this challenging disease. The exact cause of Buerger's disease remains a mystery, but there's an overwhelming link to tobacco use. Think of it like this: tobacco acts as a trigger, setting off an inflammatory cascade in the blood vessels of susceptible individuals. While the specific mechanism is still being researched, studies consistently point to a strong association between smoking, chewing tobacco, or even using nicotine replacement products and the development of this disease. Genetic predisposition might also play a role, making certain individuals more vulnerable to the effects of tobacco on their blood vessels. Let's visualize what happens inside the affected blood vessels. Buerger's disease causes inflammation and swelling, leading to the formation of thrombi, or blood clots. These clots obstruct the flow of blood, depriving tissues of oxygen and nutrients. Over time, the affected vessels can become permanently damaged, leading to narrowing and hardening, a process known as fibrosis. This cascade of events ultimately results in ischemia, or insufficient blood supply, causing pain, tissue damage, and potentially even amputation. Buerger's disease is relatively rare, with a higher prevalence in certain geographic regions, particularly the Middle East, Asia, and Eastern Europe. While it can affect people of any age, it's most commonly diagnosed in men between the ages of 20 and 45. Historically, it was predominantly seen in men, but with increasing tobacco use among women, the incidence is also rising in this population. Understanding the epidemiology helps us identify populations at higher risk and implement targeted prevention strategies. The symptoms of Buerger's disease can vary in severity, but they often start subtly. Imagine experiencing pain in your hands or feet, especially during exercise. This is often one of the first warning signs. This pain, known as claudication, is caused by insufficient blood flow to the muscles. As the disease progresses, you might notice color changes in your fingers or toes, becoming pale blue or red in response to cold or stress. Small, painful ulcers or sores may develop on the fingers and toes, and in severe cases, gangrene can occur, leading to tissue death and requiring amputation. Diagnosing Buerger's disease can be challenging, as many of its symptoms overlap with other conditions. Doctors typically start with a thorough medical history, paying close attention to tobacco use and the specific symptoms you're experiencing. A physical examination will assess the pulses in your extremities and look for signs of tissue damage. Diagnostic tests, such as an angiogram and X-ray of the blood vessels after injecting a contrast dye, can help visualize any blockages or abnormalities. Blood tests are also conducted to rule out other conditions that might be causing similar symptoms. Finally, the Allen test can be used to evaluate blood flow to the hands. While Buerger's disease isn't typically classified into distinct types, it's important to note that the severity and progression can vary significantly from person to person. Some individuals may experience relatively mild symptoms, while others face rapid deterioration and severe complications. Unfortunately, there's no cure for Buerger's disease. The cornerstone of treatment is complete and permanent cessation of tobacco use in any form. This is crucial to prevent further damage to the blood vessels. Medications, such as pain relievers, vasodilators to improve blood flow, and antiplatelet agents to prevent clot formation, may be prescribed to manage symptoms. In severe cases, surgical options, such as sympathectomy to interrupt nerve signals that constrict blood vessels, or even amputation, may be necessary to alleviate pain and prevent the spread of infection. Furthermore, wound care is essential to heal ulcers and prevent complications. Prevention is paramount when it comes to Buerger's disease. The single most effective preventative measure is to avoid all forms of tobacco use. Educating young people about the dangers of smoking and providing support for those trying to quit are essential strategies. Early detection and intervention are also key to preventing the disease's progression and minimizing long-term complications. The prognosis for Buerger's disease largely depends on an individual's ability to quit tobacco. Those who successfully quit can often manage their symptoms and prevent further progression of the disease. However, continued tobacco use can lead to severe complications, including amputation. Recent research is focusing on developing new therapies to reduce inflammation and promote blood vessel growth. Stem cell therapy and gene therapy are also being investigated as potential future treatments. While these are still in the early stages, they offer hope for improved outcomes for individuals living with Buerger's disease. Remember, understanding Buerger's disease is the first step towards effective management and prevention. If you suspect you may have Buerger's disease, consult with a healthcare professional for accurate diagnosis and personalized treatment.